Hi, everyone, and welcome to the latest installment of what has been called the Disaster Mobility Data Network, focus on data in crises. We've been planning to talk for quite some time about the health impacts of hurricanes and the role of novel data sources in understanding hurricanes, and it just so happens that this event occurs in the middle of two major hurricanes in the Atlantic right now, Hurricane Fiona and now Hurricane Ian, which made landfall in Florida yesterday as a Category 4 storm, one of the 5 strongest to ever hit the state of Florida, with what looks like widespread power outage, health impact, and infrastructure damage throughout the state. Hurricane Fiona, as we've all seen, I think, caused a blackout throughout the entire island of Puerto Rico, and has had widespread impact throughout the island, which comes 5 years after Hurricane Maria, which a number of our participants were either responding to or helped to really illuminate the true health impact and mortality impact of that storm 5 years ago. My name's Andrew Schroeder. I'm the Vice President for Research and Analysis at Direct Relief. I co-direct the Crisis Ready project with my colleagues at Harvard. And just a really quick overview I wanted to give you of some of what we've been looking at over the course of the last few days. The Crisis Ready project really focuses in on mobility data, novel data sources, impacts of hurricanes, wildfires, pandemic disease, and in this particular case, we've been looking at, this is Hurricane Fiona in a tool that we call ReadyMapper, which gives some sense of at least what was registering in the data that we receive through the Data for Good program at Meta, looking at the impact here on the southwestern portion of Puerto Rico, where the outage made a number of sort of curtailed a lot of movement throughout this area, although not all. There was not a total network outage, and we can look at the spread of population from Ponce, which was one of the most affected cities, which very limited in the immediate aftermath of the storm, but recovers at least regional movement rates increasingly over the course of the week. In the case of Puerto Rico, and I think a number of our folks that will be joining us here will discuss, the areas impacted are uniformly quite far below poverty level in terms of U.S. Poverty statistics, tend to be relatively older, particularly areas that you can see listed at the top, Hormigueros, San German, where you're talking about 28% and shortly there, a little bit less for people that are over the age of 65, which is a significant proxy for people that are having difficulties, sort of special difficulties during response to the storm. Similar kind of dynamics happening in Hurricane Ian, where the impact of the storm on Southwest Florida took place in areas that are disproportionately older, disproportionately people with power-dependent medical devices. We've seen, again, much like in Puerto Rico, widespread power outage throughout all the counties that are affected here on the coast of Southwest Florida, and now inland through other parts of the state. And so this intersection between the impact of flooding events, the impact of the storm, winds, and other sort of dynamics from the hurricane impact, linking up then with underlying risks and vulnerabilities, relative inability to move in some cases out of the path of the storm, plus then having the dependence upon power for access to healthcare and for often home-based healthcare has been characterizing both of these particular emergencies. And so with that, I'd like to kind of turn it over to my colleagues who will in succession go through some of these issues that we're facing now throughout the Caribbean and into the United States. And can, I think, look at this from a number of different angles. So we're going to start with Yvonne Rodriguez-Rewall, who's the Director of Direct Relief's Puerto Rico operations. She's actually in the field today, and we'll go from there to Mike Johansson, who's an infectious disease epidemiologist at Harvard. Also, I believe, are you in San Juan, Mike? And then we'll turn it to Gail Ranglin-Edwards, also from Harvard SPH and formerly from Jamaica Defense Force, and finish up with our colleague Hamish Patton from Oxford and UNDRR. And so with that, and then Pamela Martinez from University of Illinois will be leading a Q&A afterwards. So with that, without further ado, Yvonne, are you ready to go?
I'm ready. Good morning, everyone. Can you hear me well?
Yes.
Can you hear me? Okay. So first
Joe,
of all, I would like to say...
Oh, sorry, Joe, can you bring up Yvonne's presentation?
Yes. One.
So I would like to say thank you to all of you for your support and your commitment. For us in the field, your work is absolutely valuable. I'm going to be talking a little bit about our response to Hurricane Fiona in Puerto Rico, and then I'll add a couple of pointers and observations regarding the gaps that we have noticed would help us become more effective in the field in our response, and understand the long-term effects of these disasters and their implications on local public health issues. So I think it's very important to start by saying that regarding our efforts, there was, at least for direct relief and here in Puerto Rico, there was a lot done prior to Hurricane Fiona impacting the island. And these were, for example, since Hurricane Maria, we set up a team in Puerto Rico. So direct relief already had a team in Puerto Rico, and we have been, for these past 5 years, we have been expanding our networks of partners. So we already have contacts with the health clinics that we support, with local nonprofit organizations, with the Department of Health, and that has been key in this response, and especially in how quickly we have been able to get the aid out. Also, we were able to establish a warehouse in Puerto Rico, so a lot of material was already here, and direct relief does that. We actually study the path of the hurricanes, and we pre-position hurricane preparedness packs that contains materials, aid, medicines like insulin, and other medical equipment to these clinics that support these very vulnerable communities and are located in the path of the hurricanes. So I would say, like, prior to Fiona, in this case Fiona impacted, we already had a network going on here, a warehouse, and a team in Puerto Rico that helped us be more efficient and quick with our response. The team also, like, just minutes after passing of the storm, direct relief team in Puerto Rico was already on the phone contacting our partners, the health centers across the island. There's 20 corporations of medically federally qualified health centers with over 86 clinics throughout the island, and we were on the phone with them, just asking, how was it, how are your communities, assessing the needs, what type of medicines you need, do you have power, the cold chain, has it been affected? And just hours after that stay-at-home order was lifted, our team visited these partners across the island delivering aid. We were able, thank you. This is the first picture. We were able to deliver 6 additional HPPs, which are the hurricane preparedness packs. And those are the names of the places that we went. We also distributed 10 oxygen concentrators, and these were to patients directly referred to us by either our partners or the Department of Health, and 42 emergency backpacks to the first responders across the island. So that just happened minutes and hours after the storms and after the stay-at-home order was lifted. In addition to that, based on, you can go to the next slide. In addition to that, based on requests by the directly from the Secretary of Health and other partners, we have been delivering generators to bedridden patients or patients connected to life-sustaining equipment like ventilators, for example. As you all know, Puerto Rico's electric grid is very weak, and the entire island was without power for a couple of days. To date, we have restored power, but still we have 30% of the island with no power and 20% of the island with no water access, potable water access. So these blackouts have been a serious problem, especially in communities that are very vulnerable across the entire island, and for communities and population that has chronic diseases like diabetes, for example, because as you know, insulin needs to be stored in cold chain equipments, right? So many of these families don't have access to do that. So we have been collaborating with the Department of Health. We have delivered 9 of them, and the Department of Health already purchased 400 of these generators to be able to distribute them across the island. Then the next slide, it's also, again, thanks to the network of our partners, we have been able to gather volunteers and take them to the community to directly impact the communities affected. These pictures that you see below, this is in the town of Salinas. Salinas was completely flooded. And in this town specifically, in that community that you see there, most of the residents were elderly. When we got there 4 days after the storm, these elderly, some of them bedridden, some of them in wheelchairs, they were not even able to get out of their rooms or their houses because of the mud and the water. So many of them were without their prescriptions, without their medicines, without being able to clean up the houses. We were literally, we gathered 150 volunteers, and we were there cleaning the houses and helping, assisting these elderly to clean up their houses, take out everything from their refrigerators. And together with MedCentro, which is one of the federally qualified health centers, we brought in directly donated mobile medical units with the nurses, social workers, doctors to help take the vitals for these residents, fill out prescriptions for the residents, and again, with the volunteers, just clean up the streets and the areas where they live. Though these activities, we did that one in Salinas, and yesterday we had one in Coamo. Tomorrow we have another one in Hormigueros, together with Migrant, another federally qualified health center, and on Saturday in Guayanilla, which is another town in the southwestern side of the island, which was again completely flooded. We did a visual inspection evaluation of the community yesterday, and same conditions. A lot of patients, bedridden patients, no access to power, no access to continuing their medical needs. So again, we see the importance and that connection between power and health. That connection it's key. So in the next slide, but I don't know if we have time, it's just a thank you note that we received from one of the residents. We can play that later if there is time, but I'll just go ahead and talk about broad topics that we kind of like, by being in the field, and after speaking to Andrew about this specific event, our team in Puerto Rico gathered up, and we were talking about what could help us understand the gaps that we are seeing, and how can we understand the long-term effects of these disasters and the implication on local public health issues. So I think the first one, when we're talking about the gaps, I think one of them, it's very important to be able to evaluate the partner's work and their impact, quantifiable measures to understand the impact of these health centers to the communities, analyze the reports, compare which partners are more effective with the resources that they have. That would be key. Another one is determining geographical areas that remain underserved and the reason why. Maybe it's geography, like for example in Puerto Rico, Culebras, Vieques, which is a separated island from the main island, Castañer, which is very remote in the mountains of Puerto Rico. Also exploring the underlying conditions that predispose certain populations to remain underserved, and identify which ways local organizations, like in this case, obviously direct relief, can exert change. So that would be one, and obviously understanding the role of electrical power in safeguarding health and the impact of renewable energy in preserving these services. For example, direct relief in Puerto Rico, we have donated solar systems to 16 of these community clinics that we have been partnering with. 8 of them are already, they are working already, and they were providing resilient power to these communities, which was great to know that all of these clinics were able to continue their services during these times. 8 of them are still on the works. In addition to that, we have also donated solar systems to what it's called non-PRASA communities in Puerto Rico. We have done 33 of them. And these are communities that serve water through wells. So if they had no power, they didn't have water either. If they didn't have power, they didn't have water either. So now we have been in contacts and communications with all of them. And we learned that all of these communities were able to receive water when the entire island was without water, and still now 20% of the island is without water. So those were some of the pointers and ideas that we were bringing. Also, I would like to finish with saying, like, understanding the long-term effects of the disasters and implications on the public health issues, like for example diseases that become more prevalent. Like right now, the death toll right now in Puerto Rico ascended to 23, and we have learned that leptospirosis is one of them. There's a lot of inundations, so I'm assuming dengue is going to be a problem very soon, asthma, and definitely mental health. These people have been impacted over and over again, first Maria, then the earthquakes, then the pandemic, and now this. Losing everything. So mental health is a key issue to study and to learn how can we, continue and provide these medical services. There's also families that are consistently being displaced from their communities. Obviously, that affects mental health as well. And the secondary hazards that arise from power outages, like essential medical equipment, like ventilators, for example, the impaired medications of cold storage also. And in Puerto Rico, this time, we have had a lot of accidents of elderly handling candles and generators. We have had, unfortunately, a couple of elderly that have passed because of fires. So I'll be more than happy to continue. I know I gave a lot of information and these are broad topics, but Andrew and team, if you would like to touch on more specifics into what we have seen in the field, please feel free to contact me, or I'll be more than happy to join a next call and be able to, talk about in more details all of, what we have seen in the field. Again, thank you so much for listening and for inviting me to participate.
Thank you so much, Yvonne, and fantastic work. And I believe Yvonne has to leave, so will not be available for the Q&A, but we can pick up some of the threads that she mentioned. So I think a lot of this carries through. Mike, did you want to jump in next?
Yes, happy to. And thanks for inviting me to be here. I'm really happy to be talking about this. And thanks Yvonne and Andrew and everyone else who's contributed to the direct relief work. on the ground here, it's clear how valuable that stuff is and how much more needs to happen. So Michael Johansson, my day job is at the CDC, working as an infectious disease modeler. I'm not on the clock right now for CDC. I'm speaking in my personal capacity. And I will say that the views expressed are mine and do not necessarily represent the views of CDC or the United States government, as I am required to do when I'm speaking in this capacity. So I live here on the ground in Puerto Rico and am aware of a lot of these issues, worked on a lot of things around Maria, have not been involved so much in the Fiona response, but have been sort of seeing a lot of things that have happened and thinking about a lot of the data issues and health issues associated with Fiona and other hurricanes. So I'm going to speak a bit more broadly, picking up on a lot of the same themes that Yvonne mentioned, and sort of try to capture some of the considerations about data and understanding the impact on health in particular. So I think one framing that is important to keep in mind is about what happens prior to the hurricane, what happens during the hurricane, and what happens after the hurricane. We all spend a lot of time looking at the forecast of where the hurricane's likely to land, how strong it's likely to be, and there's really clear data on that. But then as soon as it hits, there's either the same data and you're trying to say, are we through it yet? Or are we through the worst of it? What's still likely to come? Or you completely lose access to that data because the systems go down, either the systems that are collecting some of the important data, or the people who are here on the ground and lose their communications or electricity. After the hurricane, those things come back, but they come back slowly. So you start getting bits and pieces as people get connected again. The connections are often take longest to get in the places that are most affected, which represents itself in various different ways. And of course, the data systems are not usually either online or capable of collecting the sorts of like detail and resolution at the scale that's needed to really target all the pieces of the response that are needed. This is also true of the systems. So the systems, they're all, we have prior to the hurricane, there's time to like get things up and running. The hurricane hits, lots of the systems go down, and so there's no access to them for some period of time. And then slowly they come back. Pretty much everyone in response mode, where people are trying to respond to the hurricane, but also trying to figure out how to get by themselves, how to get food, how to get water, how to get gasoline if they need electricity, how to get places. So there's this sort of the compounding of those impacts there. And then when we get to the health impacts, which I'll talk a little bit more about in more detail, those are prior to the hurricane, there's not really a lot of health impacts from the hurricane. During it, there are specific impacts that are often related to injury or sort of very immediate problems. But then there's this extended period afterwards where there's lots of different impacts, and those really expand and are sort of more complex to think about. And generally, it's sort of the aftermath that causes more of those long-term impacts than the actual direct impact of the hurricane. Which is an opportunity, right, for improvement upon that, but also understanding it. So I also want to say that like hurricanes are not, I think everyone here knows that they're not a single problem. They are complex in their own nature, and they're varied in the impacts that they can have, even the direct physical impacts. So for Fiona, we've seen a lot of the real impact has been by flooding and on the central services, principal among those electricity and water, which are interrelated, as Yvonne mentioned. For Maria, we saw those same impacts, but also much greater impacts from wind and sort of the destruction from that, including post-Maria impacts of that. In some of the areas I was at right afterwards, well, basically the whole island had all the leaves removed off the trees. So at that point, there was like much reduced capacity for the land to absorb rainfall. And we saw lots of periods of heavy rainfall afterwards that led to repeated landslides of roads being covered, uncovered one day, covered again by a landslide the next, uncovered again, just to make certain regions accessible. So there was sort of these like cascading impacts just from the physical impact of the hurricane, which then have those downstream impacts on health. Just to put in a little context from Maria, at this point where, as Yvonne mentioned, we're about at 70% of electrical clients receiving electricity from the grid. And we're about 10 days out. After Maria, at this point, we were still in the single digits And we didn't get to 70%-ish until sometime, I think it was sort of late November, which is about 2 months after that initial impact. So while the scale of what we're seeing now is way too slow, and it's a real problem in lots of ways, those impacts can be way worse. And we have seen that happen. So talking about specific health impacts, a few sort of categories of these. One is the services disruption. And we have, it's close to around 1 million people that are still without power. This impacts families, schools, businesses, health systems, government. All of those things are interrelated, of course. There's data on these. They are measurable to some extent, but the data are still unclear and they change. You know, we get power back and then we lose it, and then we get it back again. And every time it's a little bit less so far, fingers crossed. We went to report a power outage where I live just a couple days ago, and we're no longer even able to report that there's power outages. So now if there's neighborhoods that lose power, the energy company doesn't actually even know that they're losing power within an area where there's generally power access. So that's just one of many different examples about the complexity of the data that are available, even for something that is relatively well reported. There's, of course, the damage to the infrastructure. So there's damage to roads, buildings. These things impact supply chains, which have lots of downstream effects on health. The sort of data pieces there are pretty hard to measure, and some of them are easier to measure, but of course the hardest ones to measure are in the places that are most impacted and most important. There's the aspects of mobility and displacement. So there's some people who are displaced temporarily, some people who are displaced long-term. There are some metrics on that. Usually the ones that are reported are the number of people in shelters. But of course, that's only a very small fraction of the population, because most people are going to relatives in another part of the island. Some people are moving off island. Some of these are temporary, some long-term. So the impact is much greater than just the numbers that we see of people in shelters. In general, as Yvonne also mentioned, a lot of the impacts of hurricanes are disproportional. So they particularly impact the most vulnerable communities. And also there's sort of secondary impacts of that, of what those initial impacts are, but then also the resiliency and the ability to deal with those impacts. So really these disasters amplify those inequities that are already existing. And that's true for data as well as it is for people and the health impacts. I want to sort of go through some of the impacts that we see related to health. So deaths are the most obvious one, but they're still very difficult to measure. As I sort of mentioned, the impacts on deaths are usually much greater after the hurricane, at least in Puerto Rico, that's what we've seen, than the ones that are due to the hurricane, the immediate impacts, direct impacts of the hurricane. Infectious diseases, as were mentioned, we've seen a spike in leptospirosis cases recently. There's alerts for other potential waterborne pathogens. Dengue is a problem here. Dengue was already sort of increasing a bit prior to the hurricane, so we may see a rebound in that. We don't necessarily see outbreaks of dengue after hurricanes in general. We usually see a dip in mosquitoes and then a recovery in mosquitoes, and you can certainly have conditions that would increase transmission. And of course, those are health impacts compounding on other health impacts. COVID-19 is another one with more people concentrated in fewer places. There's still risk of increased transmission there. Injury, as mentioned, there's impacts from the storm, but there's also impacts in the rescue work, construction, impacts from generators, using generators improperly and having problems with them, or candles. There's all the chronic conditions, people who are having trouble getting care because of those, trouble getting access to medication, trouble getting access to sort of care that's in the home or even at the care facilities, right? Problems even with hospice care that we've seen in the past, that people aren't able to receive hospice care because of the hurricane impacts, either the immediate ones or the extended ones. Nutrition is an issue. Food availability, both because of the sort of direct impacts on stores, but also supply chains, maternal health. People rely on electricity to store milk and generate milk and formula, all those pieces, appropriate places to go for in shelters. The mental health impacts are huge. we see suicide as a spike in post-hurricane, but there's also trauma, fear of losing everything, actually losing everything, and having to deal with the impacts of that and the stress, loss of family members, either because they die or because they move to other places because of the impacts. Health systems, of course. As of Tuesday, I know that 16 hospitals were still using generators in Puerto Rico. I'm not sure if that number's gone down now. There's problems of power, water, staff, displaced people, and health system access. Like, can people actually get to the health systems when they need them? I think I've gone on longer than I intended here, but I'm going to make a few more points. One is that these are just sort of the short-term impacts. The long-term impacts are longer-term impacts are potentially even greater and also problematic. One is migration. So we saw many hundreds of thousands of people leave Puerto Rico, and many did come back, but many didn't. And that's changed the age structure of the population, and particularly losing younger people, especially doctors and other clinicians, nurses. And that means that we have more health problems and fewer people to address those health problems in the hurricane and after the hurricane. Education is an issue. We've also seen impacts from earthquakes here, where schools are slow to reopen. People are, I think, more familiar with the long-term impacts of of schools being shut down from COVID, but that's been happening in hurricane-impacted areas in many ways for years. That even includes the universities. Political, the previous governor, 2 governors ago, again, now resigned because of lots of different problems that were going on, but one was the aftermath of Maria, even though that resignation was 2 years later. And then the mental health problems, of course, these don't go away. These build and need time. So again, I'm sorry I went out, talked a little longer than I meant to. There's a lot of problems, of course, and I'm happy to discuss them more, but I'll turn it back to you, Andrew.
Thanks so much, Mike. A lot to talk about there, and connects really well to, I think, what Yvonne was going through, as you mentioned. And so it's worth noting that this didn't only affect Puerto Rico, as in many cases, as it goes through the Caribbean, a number of other islands, particularly Turks and Caicos in this case for Hurricane Fiona. I wanted to give Gail a chance now to come on and talk about her experience and observations in other aspects of the work in the Caribbean, and take it away, Gail.
Hi, Andrea, and thank you, everyone. Thank you for giving me the opportunity to present. While I load my slides, I just want to strongly echo some of the public health implications of the hurricanes that Michael and Yvonne mentioned. Let me just find my slides here. Right, so thankfully the Caribbean was significantly spared for the most part from the passage of Hurricane Fiona and Ian.
Gail, sorry, I think your slides are not displaying full screen.
All right, yeah, just 1 second. Okay, yeah. Just a sec. All right, are you seeing the slides now?
Yep, you're good to go.
Okay, great. Right, so the Caribbean for the most part was spared from the passage of Hurricane Fiona and Ian. But what we saw was significant flooding of a lot of the terrain here, and that resulted in a lot of landslides, a lot of communities being cut off, a lot of significant injuries directly from the passage of just the external bands of the systems. So I'm going to really step a little bit back and speak about the implications for the disaster response in the Caribbean and the implications for human mobility data. And I just want to mention that in the Caribbean, we have quite a number of islands that is surrounded by huge bodies of water, and most of our cities are actually coastal. Now, in the Caribbean, we form an alliance that is called CARICOM, and it stands for Caribbean Communities. And we share a lot of our policies, our disaster response, and our security arrangements through a network of approximately 19 countries. And the disaster response in the Caribbean is managed by CDEMA, otherwise known as the Caribbean Disaster and Emergency Management Agency, and is headquartered in Barbados. And what CDEMA does is really incorporate the private sector, the civil society, the general population, in addition to the government, and it focuses on all aspects of the disaster management cascade. Now, this is just an overview of the countries that actually form a part of CARICOM and actually do participate in the CDEMA emergency response. And there are 4 main subregions. And the top subregion on the left, where Jamaica falls right here, Jamaica is responsible for this region, but what we've experienced with the passage of previous hurricanes is that based on the need and the capacities in other countries and the capacities that exist in Jamaica, oftentimes Jamaica actually does lead the emergency response in the region for the most part. Now, these are the 4 main subregions, and as you see, Jamaica leads one, Antigua and Barbuda leads the eastern subregion, and Barbados leads the central subregion, followed by Trinidad and Tobago that leads the southern region. And this is pretty much the operational structure of CDEMA. It is headed by an executive director and his team, and a unit that's headquartered in Barbados, but you do have sub-regional focal points in the existing countries that actually do lead the response. So in Jamaica, it's headed by the Office of Disaster and Emergent Preparedness and Management. And unfortunately, the director should have joined, but he's unable to make it, regrettably. Now, in the CDEMA structure, you have a relief response unit that's usually headed by a strong military, police, and fire presence. We also do emergency coordination, and we also do an initial humanitarian needs assessment. Along with that, we do have a rapid needs assessment team that does initial sectoral assessments. And we do have another aspect of the team that primarily focuses on search and rescue. And depending on the hazard that may arise, we do have specialized technical teams that respond based on the nature of the hazard that's identified. Now, we do have a number of important partners that we work with. One of the most significant ones are the UNDP and Pan American Health Organization. And the Pan American Health Organization actually has implemented a system of emergency medical teams, and we do have a cadre of emergency responders, primarily in the health sector, that provides continued development and support and is able to organize structured primary care medical teams in the Caribbean. However, one of the significant challenges exists is that in the Caribbean, we do depend heavily on airlift capacity from our militaries and also external militaries. And a significant partner in that response is the Canadian Armed Forces, that every year they do drills prior to the start of the hurricane season, and they do have supplies pre-positioned in Jamaica and some other countries in the Caribbean. Now, usually how we respond to disasters is usually a 3-tiered response, with the first level being, no response is required. Now, the second level, usually there's some external assistance required, but the country can usually manage on its own. And historically, we have experienced that with a few hurricanes listed here. And the third tier is when the capacities of the country is significantly affected, and most significant in recent times was Hurricane Maria that pummeled significantly Dominica, and Jamaica had to respond to that. Now, this is just a brief overview of the impact that the hurricanes within the last few years have had in Caribbean and also in the United States and Puerto Rico. And you can see that the economic loss is quite significant, sometimes even doubling or tripling the country's GDP. And we saw this happening in Dominica with the passage of Hurricane Maria. And just to say, it is really critical
I think we may have lost Gail temporarily. Gail, are you back?
Yeah,
Oh, no problem.
yeah, we're having some of the systems here as well. So I will reshare. Okay, let me just exit. Apologies for that. Okay. All right. Just confirming that you're able to see my screen.
Yes.
All right, so the key message from this slide is really just to say that the increase in sea surface temperatures are noted to be greater in the Caribbean than that is seen globally. And as we can see in the diagram, that the temperature, the significance of the temperature increase is most in the Eastern Caribbean islands, and that is where we see most of the systems originating from. Now, there exists a huge amount of untapped potential in the Caribbean. In the Caribbean, cell phone penetration and use is very high. And it's actually more significant than internet accessibility. And what we have seen, most of the available data actually resides in Facebook and Google. And usually it does not correlate and it's not representative of the population in the Caribbean. Now, there are two main service providers in the Caribbean. One is Flow and one is Digicel. And it is believed, or we really believe, that trying to establish partnerships with these two mobile service providers will play a huge role in gaining very refined, granular data for human mobility in the Caribbean, and also shift the trajectory of how we respond in the region. Now, the access to human mobility data is very important to us because most, as mentioned before, all of our cities are coastal, and most of the Caribbean islands form archipelagos. And in Bahamas has a high concentration of Haitian migrants that do inhabit other islands apart from the main island, and data for those individuals or that vulnerable population is usually very lacking. Now, in the Caribbean, our economies tend to be very volatile. And as you can see in Haiti, a lot of internal conflicts plagues some of these countries, and it has implications for the high level of regional migration and internally displaced persons. Now, as Michael said, the Caribbean is highly mountainous, and there are a large concentration of inland bodies of water. And what you'll find is that even though we're not directly impacted by the hurricanes, the rain and the amount of water that we face just from the passage near to us actually do cause a lot of flooding due to the overflowing of our rivers. We have a lot of landslides, and a lot of our communities are cut off, and there's a high demand on the military to respond to these mountainous areas, and the airlift capacity is actually pretty limited in the Caribbean. Now, this is just an example of the reach of one of our main service providers. So you can see that there is a huge amount of data, untapped data, that is worth exploring. Now, this is just a diagram depicting the level of migration in the Caribbean. And because we actually do have a regional partnership, what you'll find is a lot of internal migration in the Caribbean for persons seeking better economic opportunities within the region, and also a lot of migration of persons from the Caribbean to North America and Europe. And that also will shape the overall picture in the population response to disasters. Now, some of the key challenges that we face in the Caribbean is the suboptimal financial support by participating member states, and they actually contribute less than 10% of CDMA's operating expenses. And because of that, CDMA is highly dependent on external funding from development partners. And there's a high reliance on militaries for airlift capacities and logistical support in the field. We saw this with Haiti, we saw this with Hurricane Maria, And on the ground, military units actually do lead the team, and they gather most of the operational data on the ground and synthesize this information and send it back to CDEMA. So of course, you can just know that there will be implications in gaining access to the data because of the barriers that may face with cell phone service providers giving this information to governments and armed forces and also local law enforcement. Now, other challenges exist include the constraints with the technical expertise in the Caribbean to analyze and distill data sets to useful information in the public health and disaster response. And this is primarily due to the economic pull of talent to high income countries, otherwise known as brain drain. And it's really impacted us within the last year with significant migration of physicians, teachers, nurses to North America, most notably the United States. Now, in the Caribbean, because there's not much technical expertise, there are actually few to no policies and laws that govern the use of data and data sharing. And there are also huge barriers to the formation of partnerships with mobile providers because of this. And also, it is customary for some countries for persons in the Caribbean to use both service providers. So this will have implications in the analysis of the data. As we speak right now, I have 3 cell phones. I have a Digicel phone, I have a Flow phone, and I have a US phone. And it is really common for most persons in the Caribbean. Now, other issues to consider include the cultural norms in the Caribbean and this huge resistance to sharing information with partners from high income countries, because over the years, we have actually been the recipients of extractive relationships from other developed countries. And these is really a remnant of colonialism and some of the attitudes that our population have and still possess. And there's always this concern of who will have access to the data and also the synthesized data. Now, we do stress the importance of having a regional implementing partner. This is critical. And I experienced recently when I tried to connect members from the disaster relief team to the mobile service providers. So it is something to consider. My apologies. Now, other key issue is really navigating the national jurisdictions and languages in the Caribbean. We do have a lot of different languages. English is actually in the minority, Spanish is in the majority, and also trying to navigate the varying levels of economic and technical development. And this will have implications for the consolidation and standardization of the data that is needed. So in closing, I just want to highlight 3 main issues. The fact that the Caribbean is particularly vulnerable to natural disasters, particularly hurricanes. And this is due to the changes in the weather patterns and the climate patterns and the geography in the last 20 years. There's high internal migration in the Caribbean, and this stresses the importance for the application of human mobility data in the context of natural disasters. There are issues with post-colonialism, intercultural differences, differences in economic resources. The Caribbean has a high discrepancy in socioeconomic classes, and there are a lot of inequities in the Caribbean. And there's also the issue of the lack of technical expertise and regulations to govern the use of data. And this will really require key strategic partnerships, funding, and concerted effort and continued advocacy. And with that, I will close and I will.
All right, thank you so much, Gail. Again, so many issues to connect. I won't waste any more time. We're already over time, but I wanted to bring then Hamish and then be able to turn it over to Pamela.
Okay, well, thank you everybody for these fantastic talks. We do have already 1 question in the chat.
Oh, wait, hold on, Pamela. We didn't get to Hamish yet.
Oh, I'm sorry.
No worries.
Sorry. Hopefully we can carve out a little bit of time here at the end. Maybe if folks some people are able to stay around afterwards, but go take it away, Hamish. Sorry about that. And sorry, Pamela.
No worries. Thanks a lot, Andrew. Thanks a lot to Crisis Ready and everyone for giving me the chance to present. So basically, we're going to take a step back, and the idea of this presentation is to try and encourage us to think differently about impact estimates. What do they mean? How can they interact with one another? And how can we use them to maximize our information and understanding of different kinds of impacts? So this is the focus on Cyclone Harold, and that is essentially just because we've been spending a lot of time developing the statistical methodology. I'm not going to put you to sleep trying to describe it, but I'm just going to give you an overview quickly during this presentation. An important thing to say is that this has been in collaboration with James O'Brien and Max Loke from Department of Statistics, University of Oxford. I was there as a postdoc beforehand, so I started this project, and then these two, so master's and PhD student respectively, have taken it forward. Okay, so what are the aims of this work? So the first aim is to improve impact estimates using all impacts. Now, what does that mean? There are 4 different groups of impacts. There's economic, there's environmental and ecological, there are infrastructural, so for example, building damages, and there are population impacts. So these can be used to actually infer one another. And a very simple example could be that the number of destroyed homes multiplied by the average household size equals the minimum population displacement in, let's say, the short term, right? And the whole point of this is just a very simple example. It's very well known, but there are loads of different intricacies on how you can relate one of these to one another. Now, the second aim is to separate error and bias. Now, what does that mean? It means that if you have 2 different estimates, right? One says 10,000 buildings were destroyed, and another one says 300 buildings were damaged, but in a specific area, then it's very difficult to compare these 2 estimates. How does one help to understand the other? They're not the same spatial region. They might, I mean, in this case, buildings destroyed, it's temporally pretty similar. It's in the short term at least. But if you're talking about displacement, they can also have a difference in temporal relationships. So these are the 2 aims that I want to tackle, and I'll explain both of them throughout this presentation. So the first part is to describe quickly validation data. I know you all know this, but I just want to rephrase it so that we can all understand a bit better where this work comes from. So the first one is what was referred to aggregated estimates. So in the province of Sanma, about 80–90% of the population is displaced. So using things like OpenStreetMaps, where you can extract different polygons of different regions, so for example, Sanma, you can then make a comparison between what your model predicts directly to the actual estimate. And you can use different estimates to compare with one another. And so there are also single estimates. So for example, a specific school or hospital that might have been damaged, and then you just have a single point. So it's not spatially very complex, but it's nonetheless very informative. And then we have things like building damage from satellite imagery. So Copernicus and UNISAT, they will go through satellite images before and after a hazard occurs, and they'll grade different levels of damage. So this was for Vanuatu, and you have sort of damaged, moderate damage, destroyed, and possible damage. And you can see there's actually lots of different areas that have been evaluated and assessed for damage using satellite imagery. Final one in terms of mobility data. So this is actually artificial data, but you can actually get this from Meta Data for Good. So these are different islands of Vanuatu, and what Meta Data for Good produce in their displacement mappings is disaggregated by sex. You have different rates of return of population since the cyclone. So this is the number of people displaced since, and then in terms of days since the hazard occurs. And you can see the sort of rate of return, and it separates between female and male population between different islands. Okay, so we need to introduce a model. Everything is a model, whether you think it's written down or it's in our heads. we have to depend on something. And a common approach is to use something called a damage function. So let's say you have different levels of wind speed and you want to infer different levels of damage. So a very high level of wind speed, so 180 miles per hour, will, may end up in 100% damage. So a building is completely wiped out or has to be completely reconstructed. Equally, if you go to low values, you have a low damage value. And you can build this sort of function. Obviously, it doesn't look like this, and it doesn't look like this in our model either, but to overly simplify it, you can sort of imagine it to be an S-curve. And this is the sort of principle we go by. Now, how we actually build this into a model is we layer different data sets one on top of the other, and per pixel, we apply these damage functions. So we apply it to evaluate how many buildings will be damaged, or how many people will be displaced, the loss of life per pixel, etc. And then using the different polygons I was talking about earlier, or the different methods for the data, we can then compare like for like, how our predictions map to the actual observed estimates for different impacts, could be economic, be it mortality, etc. So in terms of the initial results, we are finishing up. So James is finishing up over the next few weeks this work. So I'm only showing initial results so far, but this on the left is a plot of the predicted displaced population at the onset of the cyclone. And I'll go into this a bit more in the next slide, but some of the things that we're discovering is, for example, displacement is very difficult to predict. Some of the different estimates from different regions don't seem to compare very well. And that's not really a surprise because, first of all, displacement, generally, they don't have the same ranges. They might not be talking about the same date. And also the different methods for interpreting or estimating displacement is very different. You can have it from shelters, you can have it from household surveys, etc. So displacement is very difficult. In terms of building damage, I know that in UNISAT, these sort of satellite imagery data sets, they give you all sorts of different levels of damage, moderate damage, severe damage, completely destroyed. What we're finding is that it's much easier to just do unaffected versus damaged. Another thing that we're discovering is that for Cyclone Harold, because the mortality total was very low, this actually meant that we predicted our predictions weren't very good either. So when we apply it to maybe a cyclone or a hurricane that has had a higher mortality, you might expect that we might actually compare a bit better in that sense. I won't go into the final point. Okay. So to couple the mobility data, what I'm going to show you is the plot of the displaced population split by female and male population by grouping it with this artificial mobile phone data. So on the left is female displaced population at day 0, and on the right you have male displaced population. And you can sort of compare by using this rate of return from the mobile phone data, you can actually compare before, so day 0 to day 40, and you can sort of infer, okay, there are certain islands that have a larger female population still displaced at day 40 in comparison to the male population. Final slide is to talk about bias. So I mentioned this briefly earlier. So I'm not sure whether this will be clear, but imagine that each of your estimates that are made actually, for example, one of these could be number of buildings damaged in San Mar, or, a different city like Luganville. Then if our predictions are giving a certain damage percentage, and the value of the damage that is required to get the observed value is along the y-axis, then we might be able to single out certain singularities that don't conform to the rest of the data set or to the rest of the observed or estimated impacts. And what we're going to see when we move forward with this is to see whether we can infer different estimates and whether they correspond to the rest of the impact estimates or not. So to conclude, this code is called the ODRIN code, the Oxford Disaster Displacement Real-Time Information Network. It was developed during my postdoc at Oxford, and we have James and Max who are taking it forward, who are working in the Department of Statistics. This work aims to improve impact estimates using statistical inference. We were able to infer spatial building damage, mortality, and in combination to mobility data, we can also try to infer spatio-temporal displacement. We can also try to separate bias from noise and isolate specific estimates that don't seem to fit with the rest of the data. And finally, in the future, what we're going to be applying this to is a range of different recent hurricanes in Puerto Rico and trying to infer this bias and dig a little deeper. So that's all I have to say for today. Thank you very much for listening. I'll pass it back to you, Andrew and Pamela.
All right. Apologies, we're way behind time, but Pamela, let's take at least 10 minutes or so to talk. If folks have to leave, that's totally fine. But if folks have questions, go ahead.
Okay. Thank you, Amish, and I apologize for that confusion. Okay, so there was one question at least in the chat, and the question was, in terms of meta displacement movement data, what other displacement data is available? And this in terms of like maybe governmental or like from the UN. Any work underway or plan to understand the strength, limitations of the new meta displacement data? Any plans to benchmark meta displacement against other data sources, especially field collected data? That's the first question in the chat. I don't know, maybe Andrew or...
Yeah, I can give, I mean, Andrew probably can give a better answer for this than I, but I like there's at least two that I can think of. One is like the number of people in shelters. Another is on an island, the number of people leaving the island. And like on flights, right? That's usually the way that people leave Puerto Rico. So you can sort of monitor numbers of passengers and going in and out, and that tells you something, not all the details about where they're going and why. And then another is with survey data, right? So the post-Maria surveys run by the Harvard group did shed some light on that. The timeline of that is not like, that's not real time. But I think it is an important complement to understand what those sort of longer term impacts are.
Thank you. Anyone in the group would like to add some comments?
I don't know if Omari is still on, but I maybe if you are, wanted to maybe comment really quickly on changes in the data from Meta. I know that Hamish was showing, data that was looking at the cohort-based displacement. There's been a number of changes in how the data from Meta get calculated, and if you would like to kind of mention that, might be actually really helpful.
Hi, Andrew. I'm sorry. I hope it's not too loud in the background. I was just listening in, but I'll try to address this as much as I can. So in terms of our displacement data sets, there have been a few changes, one of which affects actually the availability of the data set. Before I get to that, one aspect of it that we've been really heavily focused on in the earlier part of this year is actually reweighting that data set. So previous versions of it essentially reported displacement figures of essentially numbers of Facebook users who were in various stages of displacement in an affected disaster area. That was helpful, but I think we found was especially that kind of comment on representativeness of the data set. So we essentially applied a two-stage weighting method where we essentially compared our observation of Facebook users, compared that to essentially on the ground estimates from some of our population density data sets, and essentially used techniques used in survey resampling to reweight the data to an estimate of on the ground displacement. So that's available, and I'll actually post a quick link that goes into a little bit more detail on the methodology behind that. Earlier this year, we have had a change in some of the available location data that's available just within the entire company. So right now, actually, our displacement data sets are not available. We're working on replacements kind of in kind to the ones that Hamish was alluding to that also include this this methodology of essentially making them more representative. So we're kind of in a holding pattern when it comes to these ones. We've been working on some other data sets, but I think when it comes to this question on displacement, we're still pretty heavily invested in that. We're just kind of working on a better solution using the data that we have compared to the data that's not available anymore. So I hope that's helpful. Happy to go into more detail and share as much as I can. The link, like I said, the link that I pasted kind of talks through a bit more detail on that process of making essentially upsampling the data to estimates of displacement on the ground, which I think is a huge improvement of the data set.
Thank you for that answer. Maybe Amish, would you like to add some comments to that as well?
Yeah, I mean, I think it's a really interesting time because a lot of these different organizations are really opening up and making access to their data super easy and very well structured and standardized. So, you know, from some of the resources we've been using, IDMC, I worked IDMC for a while, which is all about triangulating different displacement estimates, which also used that method that I was talking about earlier, so building damage estimates. The sources really range it's quite in different sources. So it could be, you know, Red Cross, Red Crescent. It could be the IOM, their displacement tracking matrix. Could be news and media. And I think this is the point, is that what we would like to do from our modeling perspective is to not, you know, when you introduce this bias of saying, I prefer this source to that source, that is subjective. And sometimes it's well-founded, and sometimes it is less well-founded. And what we want to try to do is basically try adding no subjectivity at all, where each and every source is completely equal, and then also introducing like a natural subjectivity and a well-informed subjectivity. So well-informed would be someone saying, we don't trust this source, we do trust this source. And then in terms of the natural subjective, sort of data-informed subjectivity, looking at different sources that, for example, IDMC used in the past, and ranking it and giving a weighting to each estimate like that. So I'm not sure if that answered the question, but yeah, that's how we're moving forward with it. Thank you.
Thank you. And well, Gail, would you like to give your thoughts as well related to this question?
Yeah, thank you, Pamela. So I just really want to comment on the issue really with the access to telecommunication data in the Caribbean. As mentioned, we tried really hard last year to get through to the leadership at Digital and Flow, and it was really challenging. And going forward, it really required a concerted effort to try and establish the benefits of use of this data. Last year, when we had the COVID-19 pandemic, we had an organization called Amber Communications that essentially captured data on persons returning to the island, and most of the returning passengers shared their mobility data with this organization, and it was primarily used for quarantine enforcement. And then what happened subsequently in the last 2 or 3 months, there was an issue with the security of the data. There was a breach that was exposed by a third party. And because of that, there's this huge resistance of the population to even be willing to share data with other third-party organizations. So it really will have to require a lot of advocacy, a lot of work. And I believe that with continued engagement, we should be able to get there, because it's really important, because the internet availability in the Caribbean is very, very low. In some areas it's 50%, some areas it's 20% and 30%. So really having access to that cell phone data is really critical to fully appreciate and understand the population movement in the Caribbean, and also extrapolate that on the background of the existing high mobility in the region.
Thank you. So it seems that there is no more questions in the chat, at least. I don't know, Andrew, if we do have more time, or we should try to closure it. I'm not sure about the time.
No, I think we probably are like substantially over time, but I'm glad we had some chance to actually go through some Q&A. Really helpful, everyone. And thank you, Pamela. And I want to just a quick shout out to next one of these meetings will happen at the end of October. We're going to revisit issues around displacement from the war in Ukraine, and bring together a number of folks that have been dealing with analysis of the refugee crisis across Eastern Europe and the rest of the European Union. So as well as internal displacement within Ukraine. So we'll be back around with more information about that event, and look forward to seeing folks in the future.